Hiccup is a very common thing. A lot of people have experienced in a lifetime. And hopefully one of you is one of those who have had it and frequently and resolves it on your own. But the nuisance about this issue is that it comes out of nowhere. What it is, your diaphragm will just go into spasm, and that's a sheet of muscle. It flops up and down. So you could be eating something very spicy and all of a sudden you have a hiccup. The cure a lot of times is everywhere. You know, you hear people drinking upside down, swallowing, and getting shocked, suck on a lemon, holding your breath, so many different ways. There are some things like that helps the muscle relax in your diaphragm. Baclofen is one of them. Clobomazine is another one that is can be given by mouth and or even injected. A lot of people say, oh gee, I just swallowed something very fast or something very hot and spicy that irritated you. So that's because of the stomach is being irritated. And some people have a heart condition that can cause the flutter. And because there's a nerve called vagal nerve, that is something that if you're irritated can help the diaphragm to go rapidly up and down. If you have an abscess or infection in the liver, they can cause irritate the diaphragm and it causes hiccup. And in fact, a lot of people have hiccups and pain up to the shoulder because of gallbladder infection. And of course, psychologically, you can be very anxious about certain things, you know, that can cause hiccups. So you can imagine how many causes. A brain tumor can cause hiccup. I think most of the time it's a benign thing. It goes away by itself. To me, after 30 years of experience of taking care of patients, hiccup, to me, I think the number one, the readily available for people to take care of and treat themselves is actually by deep breathing. Now, when you deep breathe, you are actually helping the lungs to expand to the maximum. And you stretch. You take a deep breath in, it goes down. When you hold your breath like that, I would even go further. Another time, and after 5 seconds, and then another time. And when your diaphragm is stretched out to literally, you know, flat and right across, you hold it as long as you can, you know, for 20 seconds. Then you breathe out. You can repeat that again and again. And I think that stimulation of voluntary deep breathing can offset the stimulation of the vagal nerve. Another way some people like to do is offset the nervous system. One is stimulating the diaphragm to contract the vagal nerve. The other way is opposing it. Acupuncture can do it, acupressure can do it. Some people will press on the eyeballs, but of course not excessive. And see if you can oppose the, by using a different nervous system, you can stop the diaphragm from rapidly going into spasm. So that's another way of doing it. Thank you for viewing my videos, and I appreciate your time and effort. Please don't forget to subscribe, so in the future, any new videos that comes along, you'll be automatically notified.